Hey everyone! Having watched shows like Grey's Anatomy and House MD, I've often wondered what the life of a surgeon would be in India, within and outside an OR or an OT as it's called. I'm very excited about today's episode because we're in the Wockhardt Hospital and we're meeting Dr. Raman Goel, who's the director of the Metabolic and Bariatric Surgery Department. Dr. Raman Goel has over 20 years of experience and is one of the pioneers of bariatric surgery. In fact, he was the first Indian bariatric surgeon to have been conferred with the Award of Service of Excellence from the US-based Surgical Review Corporation. So before we invite Dr. Goel to join us on the show, press that little bell on the screen so your phone gives you a little tinkle every time I come online. Don't forget the subscribe button and like us at Facebook at ChetChat 101, at Twitter at ChetChat 101 and at Instagram at ChetChat 101. And now let me invite Dr. Raman Goel to join us. So Dr. Goel, thank you so much for inviting us over to this wonderful hospital of yours. And thank you for being with us on the show.
Thank you for inviting me.
They've been very curious. We've done a few videos on, medical life in general as a doctor. But looking at life as a surgeon, that is something they've been asking me that, how is it to be a surgeon? So that's what I thought I'd ask you.
I think surgeon is a very exciting field. Surgery is an exciting field. There are not many branches which gives the kind of adrenaline rush that surgery gives, because you are responsible for life and death.
Right.
And every decision makes the difference. So the nearest that anything comes nearest to surgery is flying an aeroplane.
Okay.
Yeah.
And sometimes a fighter plane because you're against time and there are new challenges coming up.
Yes, and there you are taking decision when your own life is at stake, but here is the life of another person at stake. And whatever you have been trained, human body has variation. It's not like computers that there is a hard disk and there are RAMs and ROMs.
Right.
Here every time there is a different blood vessel and all. So despite learning everything, you have a challenge to take a split-second decision which can change the life of the person and the family permanently.
Right.
So I think it's a very good branch for students to look at, those who want to have some excitement.
Absolutely. In fact, one of the questions they also want to know is that, is it a field where they're going to find it difficult, or is it a field that once they're good at it, they will be, smoothly sailing?
I don't think it's very difficult. It's more of a mental ability to evaluate things. I always say surgery is done by the brain, not by the hands. Okay. If you are getting trained for 3 years, everybody learns how to do surgery. But the decision making is the real issue.
Right.
So I don't think it's difficult.
Okay.
If person has that approach that you need to give solutions and you have a ability to analyze things. So probably a film critic or people who analyze their results very well could be very good surgeons also.
Okay.
Yeah.
Okay, so analytical skills, thinking skills, like you said, being able to take split-second decisions sometimes at the spur of the moment.
Absolutely.
Presence of mind.
Yeah.
So tell us, what motivates you every day when you get up, you come to the hospital, you've done over 2,000 surgeries.
Much more.
Or more.
Yes.
Now every day you come into your clinic or your hospital, and what do you do to motivate yourself so that you're as good as new every day?
The very fact that you are in a world which is full of competition, so you wish to learn new things, and that keeps you excited. Because of technological development and research, so much new is coming. It's like having the iPhone 10 or looking forward to iPhone 8.
Yes.
So the same thing is in surgery, that we are looking at the new developments that are coming every day. We started with open surgeries, then we went to laparoscopic surgeries, then we went to mini lap surgeries, then 3D cameras came. It's like playing video games, and now you have robotic surgeries. So I always believe self-growth is word growth. So if I change myself, the word transforms.
So there are students probably doing their MBBS and deciding what major they should take when they do their postgraduate specialization. What would be your advice to them? Say they are choosing between a medicine field or a surgery field. How would you advise them as to what they should pick?
I am a surgeon. I would always say surgery. So best thing would be that they should watch as they rotate during their internship, see what interests them. So a lot of people decide they want to do obstetric and gynecology, which is also a surgical branch. Some people start enjoying orthopedic. Some people like laid back diagnostic kind of thing, which is very high in the priority, or surgery.
Right.
Now that the time things have changed because they have to go through an entrance examination.
Right.
So it also depends on where they come in the merit of the
Yes.
entrance examination.
Yes. Yes.
But I think surgery is looked up everywhere in the world as a very good branch and a high ranking branch. So people should look at it very seriously.
Fantastic. So once they've got this, let's say they've done their PG, they've chosen surgery, one of the surgery fields as you suggested that they like, they've picked it. Now they move into a hospital to do a residency program, let's say, and their early days of being a surgeon. At that point, what do you suggest to them? How can they prove themselves? How can they get that surgery where they can sort of independently, maybe not in the beginning, but try to do some independent work and prove their credentials?
So it's a gradual process. So once they are done, let's say the residency in India, it's about 3 years. Post-graduation in Western world, it's 7 to 9 years.
Right.
But it's all paid. So people take it as a part of education. I say you start working 5 years after you're done your MBBS.
Okay.
Even in internship you are paid, even in post-graduation you are paid. You may not be paid at par with somebody who has done an engineering, but you are being paid well enough that you can look after your family and grow. And as they go into residency, they are increasingly given more and more responsible surgeries, more complex surgeries.
Right.
And then if they are doing well, the seniors or their bosses automatically let them do more and more surgeries. Students are fortunate that in today's time, corporate culture has come into India. Now they have full-time jobs in all these corporate hospitals. So if the person is not very ambitious in terms of money making, one can do a decent corporate job where they are allowed independent charge and they can prove their mettle. So I think we are living in a golden era of medical sciences now, where there are opportunities in almost even tier 2 cities. The problem is how much money you want to earn. When you start thinking, then there is a problem. Otherwise, if you want to lead a good, comfortable life initially, medical sciences have no problem. And the advantage here, there is no retirement. As you grow, become more and more senior, everything improves.
So in fact, this was beautifully how you explained that they start earning. But one of the challenges I find, students come to me and they say, we are telling our parents कि हमको doctor बनना है. और mother is saying, नहीं बेटा doctor मत बनो. तुम तो 40 years के पहले तो तुम settle नहीं होगे. So the challenge is also the time, in people's minds, they feel that, it's going to be 35 or 40 before we are actually totally settled, as they call it. So you did mention it was paid, but is there anything else you can share with them to help them to take this decision?
No, I think this totally shared business, settled business is the real problem. If you are able to earn enough to have a good, comfortable life, if you can have a family, it's amazing.
Yes.
The best part of medicine compared to any other branches, you have a lot of human to human interaction. You meet 10, 20, 30 people, new persons every day. When you go on travel, you meet strangers. Here those people are coming in your room and meeting you, sharing their problems and their joys with you. So I think medicine is an amazing branch as long as you have a knack for it.
No, certainly. And the ability to save lives, improve people's lives, families, directly you can see the impact of the work you do every single day.
Absolutely.
It's
like how the barbers barber would do a job and within 15 minutes you know how good he is. So the same thing is with medicine. You are able to prove your credential within an hour or 2 hours in surgery, and medicine maybe in 4 or 5 days.
So, Dr. Goel, I'm very interested to know about the actual surgery that you do. So, how do you plan for it? How many hours does the actual surgery take? Can you take us through the entire process?
Okay, so basically the surgery starts when we see the patient. In surgery, it's the basic premise is that do no harm. First, do no harm.
Right.
So when we see a patient, we consult a patient, first thing is to decide whether this person really needs a surgery.
Right.
Everybody who walks into my consulting room should not be offered the surgery, because there are many people whom you should refuse to operate because their disease is not serious enough, or they don't need it at the moment, or the surgeon is not competent to do it.
Right.
Okay, then send it to somebody who is more competent. Then the patient, preparing the patient for surgery. More than that, preparing myself for surgery. So it's typically that if we plan a surgery tomorrow, we go through the patient's reports and everything. And now with the technology, there are no surprises. It's not that you go in and you suddenly find something that you cannot handle. Typically, when we come to the hospital from home, whether it's half an hour drive or 1 hour drive, I always keep the music switched off in the car, and I'm thinking about the patient and the surgery, thinking about the steps, because even if I have done the same surgery thousands of times, it's always better to revisit the steps. So mentally thinking that this patient has this thing extra, whether the patient is allergic to a medicine or whether the patient had a previous surgery in the same area, so where I'm going to take the cut. So you are almost aware what can go wrong, that if you plan well, it's unlikely to go wrong. And even in the hospitals now, we have those checklist system, just very much like an aviation sector.
Right.
So we have checklists in advance. The nurses know what instrument Dr. Goel needs. When we go in, a nurse checks out, is it the same patient who is there? They matches the name and the number of the surgery, the site of the surgery. Everything is spoken aloud, and everybody is supposed to respond to that. So the checklist before surgery. Once the patient is anesthetized, before I'm going to take an incision, again another nurse does the second checklist, that are we expecting any problem? Have we arranged blood? Have the antibiotics been given? And at the end of the surgery, we have the checklist again, the third checklist, that whether we did the same surgery or did we have to change the plan, and why did we change the plan. So I think medical sciences have learned a lot from aviation sector. So it's like a debriefing at the end.
Right.
And not only that, we have the entire operative notes and the post-operative notes on the computer now. So it's unlikely that I will miss out something. I mean, I remember my days in medical college where we will sit down and write notes, and invariably we will miss out because you're tired, working for 36 hours at a stretch. We'll miss out either a painkiller or the IV fluids, and the nurse will call, Dr. Goel, you missed something. And here we have everything on the computer, so I just need to sit and decide, okay, this person also had diabetes, so I add one medicine here. Or this person is asthmatic, I add medicine and just press a button, print, and everything comes out.
Fabulous.
So I think the surgery has improved, and it has become easier for younger surgeons to take it up because the stress levels have reduced.
Possibilities of error are automatically getting reduced.
Significantly reduced, yes.
It's wonderful you talk about those visualization techniques of how you go through the entire surgery in your mind. I remember another analogy. I read a book by Sachin Tendulkar, and he said that when he has to face those fast bowlers and the first ball, and if he's opener or number 2, how he would visualize. He would actually go to the stadium the previous day, look at it in the lights and visualize. And it's beautiful how you say that, and how you are successful in your surgery because you actually go through everything in your mind. And it's fantastic for them to learn this from you. But tell us, you did say that technology has reduced surprises. But sometime back you mentioned split-second decisions. So let's talk about some challenging moments, some times in the OT where you looked and you said, hey, this is not what I expected.
So what happens, as I said, the human body is not like a computer. So we need to take these decisions on an everyday basis. So we go in and something which should have been there is not there, or it looks something different. Now, after doing surgeries for 30 years, I have realized what you see with your eyes may also not be correct. So, how they say in the courts that eyewitness. Now, the eyewitness thing doesn't exist in surgery.
Okay.
You see something, you feel it's an artery and it turns out to be a duct, and you feel that it's a duct and it turns out to be an artery.
Okay.
So, I think the advantage of experience of being trained, advantage of feeling it, advantage of having a team around where somebody else says, I don't think this is an artery, Dr. Goel, let's first verify it. So there are technologies available for that. We can get an ultrasound in the operation theatre and check it out on table. So we have technology to verify that. But I think even technology only helps you arrive at a decision, but at the end, it's a decision of your own. And so those moments will never go away. And many times it happens that we are operating a patient, which is extremely difficult because this patient had 2 or 3 surgeries earlier. Everything is stuck. And the biggest consolation is when you do a good surgery and you come out and you have a cup of coffee, or at the end of the surgery you say, I have done a good job, loud. And everybody says, yes, we know. But I said, I'm feeling good. So I'm saying I have done a good job.
Right.
So I think that satisfaction is paramount.
Absolutely.
And that comes out because you are exposed to those difficult times again and again and again and again. Yes.
And I like this about telling yourself you've done a good job, because when you go out and meet the patient's family and you've just finished telling yourself, you're carrying that confidence to them.
Absolutely, absolutely.
And they only read your signs actually.
So I think for a beginner, it's very important. So when I started my bariatric surgery, let's say, I was shaken up because these were the patients who were 180 kg, 200 kg each. And I was a young surgeon, so I did not have that kind of confidence. And so if I see 100 patients, hardly 1 or 2 would get operated. And the reason why, as you rightly said, they could read my insecurity, my lack of confidence. So in medical sciences, it's very important that you stretch yourself through the training so that all your quota of error is completely over by the time you come out of medical college or come out of training. So you are a confident doctor. And when you are a confident doctor, patients already know it when they sit across you. And your conversions or your acceptance is much higher. So never be in a hurry to come out and start practicing. Get trained well. That is the basic requirement before somebody starts, whether it's a surgical practice or medical practice.
So Dr. Goel, another question that I think could be important for them is, some of them as surgeons have a long day, or maybe the particular surgery itself could be a long process. You're standing over, you're bending over, and sometimes when they go back, they don't really get time, they're very tired. So what is your advice to them in terms of maintaining their own personal fitness while, this career is definitely very demanding on them?
Yes, absolutely. This career is physically demanding besides the mental challenges that we have discussed. Because sometimes we are even standing for 8 hours at a stretch. So it's important that every surgeon maintains their physical fitness. Now, this can only happen if they are exercising regularly. It's a challenge to find a time, but it is doable. It's very funny because as youngsters, when we have time, we don't exercise. And as we become busy, we start finding time to exercise because it's become a necessity. So what has happened that when I started my career, I was never exercising. I was exercising till I went to medical school. Then stopped because I became a surgeon and I thought I am very busy, I don't have time. And then the body started complaining.
Right.
So I would have back pains, I would have elbow pains, I will have tennis elbow. And then each of us, most of the senior surgeons started realizing exercise is important and started finding time to go to gym. And then now we are in a situation, we are in a gym for at least 5 days a week, doing strength training. So I think physical fitness is the key for a successful career. It's like a sports injury. If a cricketer has a knee injury, is out for 2 to 3 months. It's not a question of how much work you lose. It's a question of it sets you back in your career.
Yes.
Be health conscious, exercise regularly. It's not necessarily to go to gym, but do an active sport to remain fit for any profession today.
Absolutely.
Yes.
And it gives you the confidence, it keeps you motivated and feeling good about yourself, and your ability therefore goes up as well because you're confident.
And also a family life.
Yes.
I operate on obese people. I tell you, the biggest issue they face is when the child runs uphill on a hill station and they say, I'm standing here, you go, and he says, Papa, come and catch me, and you can't run.
Oh dear.
I think it's such an emotional trauma for a parent.
And talking about family life, that's another area where surgeons sometimes, feel that's a weak point. How do you manage the balance between your long working hours and your family life?
So I think once you start enjoying your work, it's equally good as having a dinner with your friends.
Does that mean you got to skip that dinner with the friends?
I don't want to skip dinner with my friends, but I enjoy these dinners through the day. As I am operating, I am enjoying my surgeries. But at the beginning of career, yes, indeed, people work 12 to 14 hours a day. So one of the things that has been established, scientifically proven, that the surgeon must be well rested. You must sleep for 8 hours before you start the next surgery in the morning. We are operating on high-risk patients, so we need to be very careful.
Right.
Find time to spend weekends with the family, go out for at least one long vacation every year, and be there when your child is having their annual days, when they have their graduation ceremonies. You have to be there. There is nothing more important than that.
That's nice. So tell me, before we wrap up the show, Dr. Goel, is there any last piece of advice you'd like to give our students?
All those who are studying well must realize education is the biggest asset. So study hard, learn things. Don't go on the rota system that I want to clear exam. Learn things, because every day is an exam. In the operation theatre, it's like driving a car. When you're driving a car, you take a split-second decision. If a hen or a chicken comes in front, would you run over it? Even a child could have come in front. So you need to take decision. You need to know driving very well. So same thing is, get educated well, get trained well, be a good human being. That's even more important than being a good surgeon, because if you are a good human being, you will be considerate towards your fellow human being. So I think it's an overall package. And then be a role model to your juniors. Even at your age, when you are studying, you should be a role model to the youngsters who are 5 years younger to you. So I think this is all I can advise.
Thank you so much. I think that was invaluable, and I really appreciate the time you've taken out and the effort to be with us on ChetChat.
Pleasure meeting you.
Thank you so much for watching, and if you have any questions that you want to ask me or you want to ask Dr. Goel, put everything down in the comment section right under this video. Like us at Facebook at ChetChat101, at Instagram at ChetChat101, at Twitter at ChetChat101. Don't forget to press that little bell and the subscribe button, and happy watching.